parenting. I'm Dr. Sindhu from this Twins World channel, and today we are going to discuss regarding baby birth. Baby birth is one of the tedious tasks of ever first mom because it's not easy to handle when the water is falling on a baby. And as we know, baby birth is one of the cleaning procedures. So whatever dirt is there in the body of the baby will be removed. We need to understand that in the womb, the baby is covered with a white cheesy substance called vernix caseosa. So once the baby comes out, in earlier times, we used to clean the baby completely so that our baby will come like a pink baby with no white appearance throughout the body. This white cheesy substance helps for a thermal regulation or thermal management or prevent the heat loss. So nowadays, it is not advisable to remove the complete vernix caseosa from the body. So they remove the extra vernix caseosa and that will be given to the mother or the concerned baby. So we need to understand that previous days a hospital bath of the baby was advisable, and the first day itself baby will be taken for a bath and washed and we will get a most beautiful baby. But nowadays in hospitals this baby bath is not allowed. This is because 3 days, by the third day the child is comparatively better adjusting to the normal environment and the child is able to come to normal adaptation of the temperature. It is not necessary for a preterm or low birth weight baby to be given a baby bath immediately. Wait till the baby is stabilized. If in case of my experience, Keith was given the first bath on 36th day and Enoch was given in the 40th day of life, because both were taken time to adjust to normal life as well as it took time for them to be stabilized. So what we can do is we can sponge the bath, or we can make a cloth wet and we can wipe the baby and take instead of baby bath, so that way we can keep the baby clean. Okay, and the ideal time of a baby bath, if you speak, it is half an hour before the second feed, or by 10 o'clock feed you can give, means by 10 o'clock if you're going to give a second feed, by 9:30 you can give a bath. Why? Because bath always soothes the baby to have a better sleep. What is happening for a bath? The blood circulation is increasing so that the baby can have a muscle relaxation during the bath, and it actually conducive for a better and longer sleep. If you see the types of bath, the first one is a sponge bath. I already said that, with a wet cloth, wet soft cloth we are going to wipe the baby and we are going to dry the baby. Another type of bath is oil bath. If we see the traditional practices, our mothers and grandmothers always give importance to oil the baby very thoroughly so that they will say that you will get a healthy and golu baby. But it's not necessary that a trained person need to massage the baby with the oil. Even we can do the same thing. The purpose of oiling is to increase the blood circulation. So whenever we are applying oil, whatever oil we are using, some people use ghee, that is more thicker the content of that oil, the more the nourishment or the oily content or the texture of the baby will be better. So whenever you put oil to the baby, put it in the opposite direction where the blood circulation goes, which that can stimulate, the massage can stimulate better blood circulation in the body of the baby. And bath can be given in different ways. One type or the common type of baby bath has been done as a demonstration. It will be shown in the later video. And the other type of bath is the lap bath, and the other one is we can keep on the feet of the baby. Whenever you are keeping the baby for a bath, make sure that the head and neck and the upper portion of the shoulder will be little elevated so that the baby have a better breathing capacity or a patent airway. So let's see what are the articles we can use for the baby bath. And the articles we are already discussing. The two main aspects we always think about while giving care to a baby is the eye care and the care of the umbilicus or the navel. So the eye care, we need to understand from the first day itself, it's good to clean the eyes. How to clean the eyes? What you can do is you can take cotton balls. I have shown you how to make cotton balls in the later video while giving a baby bath. With the cotton balls, you can have the boiled cool water. We can soak it and take out the extra water and clean the eyes from the inner aspect to the outer aspect. One stroke is enough. You can turn it and use the other side one more time to clean the eye, and you can use a second cotton ball in the same manner to clean the left eye. So this way you can clean the eye. If you are not cleaning the eyes on the first day onwards, what happens, the child may get an eye infection. It may end up in starting an antibiotic or any other ophthalmic solutions. So it's better always clean the eyes. The second point what we need to understand is the umbilical cord care or the navel care. We always know that once a baby is born, there comes with a clip, there is the cord clamp, and there is nothing we need to do for that clamp or that umbilical cord. By third day or fourth day it may fall off. Just have a look on it whether any redness is there on that particular umbilical clamp. Otherwise there is no issue, and please do not put anything, no powder, nothing on this umbilical cord or the clamp. And the procedure of bed bath will be shown in the coming video. Once the baby is given bath, wipe the baby immediately, otherwise baby can go for a shivering. And once the wiping of the baby is done, put some body lotion and powder with a puff on the baby, especially on the genitals or the armpits, on the neck where there can be more moisture on these creases. This puff or this powder will help to absorb the extra moisture of the body as discussed before. Hope this session is useful for you. If you have any practical difficulty to give birth to a baby, please contact me through my mail ID or through comments, and that will help you more. Thank you for being a part of this video. Thank you. Now we are going to see how we can give a baby bath in the normal setting. So first we need to see what are the things we need to have along while going for a baby bath. Why we need to arrange the articles? Because unless we are not arranging, we may be hurrying to run around where the baby will be in cold water or exposed to a cold temperature. First we need to understand that we need to have the articles like the tub with water, warm water instead of hot water. And how to check the water's temperature is we are checking with the wrist, so that you are able to understand. It should not be warm, it should be little warmer than the normal temperature, or with the wrist we can check. These are the two methods you can check the temperature of the water. You can have a bucket of another set of water. If the water becomes spoiled, we can use another water. Then other articles what we can use is we can have a baby bath or a soap to clean the body. You can have a shampoo. If you're going for an oil bath, you can have a oil, baby oil. Then what we can have is we can have cotton buds. 2 cotton buds I have kept. One is to clean the nostrils if there are crusted secretions are there. We are not supposed to insert it, but you can clean around the area. The wet cotton bud is used to clean the ear. We are not keeping inside the ear. The ear lobes, the curves whatever we are having, we can clean it with the ear lobes, means the cotton buds. If the cotton buds are not able to be used, we will be using the cotton buds, wet soap cotton buds after removing the water we can use. And other articles are we can have a powder with a puff, and we can have the towel to wipe the baby, and we have baby clothes and the cloth to swaddle or mummify the baby. So once before taking the bath, we need to understand that always raise the head of the bath. Whenever you give bath, it's always better the baby having a little head up. Whatever bath you are going to, better to have a head up. Or what we can use is keep your hand in between the head and the shoulder, so that the baby is well supported with him. And we need to understand that first we need to clean the eyes. What we can do is you can take the cotton balls and we can soak the cotton, remove it, and clean the eyes of the babies. Okay, so once you clean, you need to understand that even if you are not giving bath of a baby, cleaning of the eyes is very important, because the secretions of the mucus what is producing in the eyes can make some kind of infection if regular cleaning is not done. Once we are done with this, what we can do is we can close the ear. You can fold the ear of a newborn with 2 fingers what you have on both sides of the head of the baby, and close the ear. So if you put water on the face of the baby also, it will not go into the ear, and ear can get with any kind of infection. So what you can do is you can wet your hand and you can wipe the face of the baby. You need to understand that you should not put any soap on the face of the baby, because it can irritate the eyes. Another thing we need to understand that the mouth of the baby need to be taken care very well. What you can do is you can wet your finger, your hand should be very clean before giving birth to the baby, and you can clean with the finger all over the gums and the tongue and the inner aspect of cheeks, because the tongue of the baby always have white dots which shows that the baby is breastfeeding baby, and while you're cleaning, all these things can be removed. This way you can clean the mouth of the baby. Once the mouth is clean, what you can do is you can start with the bath. What you can do is you can wipe the head of the baby. If you're using the shampoo, take the shampoo. You can use it again. You can take the water and you can clean the head, and you can use the towel to wipe the head of the baby. And once it is done, what you can do is two ways you can do. You can either keep it on the mat and do the baby to the bath, or you can hold in such a way that the entire body of the baby will rest on the hand of the mother. If that's the case, you are taking the water and you are putting water all over the body of the baby. You are putting more water on the neck and the armpits and the groin area where more secretions or sedimentations can be there. Then once you take the soap and you apply soap all over the body of the baby, and what to turn the baby, this way you can turn the baby so that you are holding on the cheeks and the body is supporting the neck and the chest of the baby, so that the back also can be cleaned well. Once this is done, you can use the water, you can wipe it, and you can use the same way you can wipe it. When you come into the private area, special care need to be given because secretions will be there, especially if it is a baby girl. So you can use more water and clean the private area. Once you've done it, you can immediately dip the baby, you can take it and keep the baby, and you can wipe the baby. Understand, bathing is not an easy procedure because the temperature of the baby is changing and the baby end up crying very badly, and bathing is not a long procedure, it's a very fast procedure. You need to wind up fast and you need to put the clothes after putting powder to the baby so that the temperature will not be lost much. We are going to see how to make a cloth nappy. So usually how our mothers used to do is take a cotton cloth and they will just pull one corner to the other corner. That makes them to get a triangle, and we will keep it like this. You can go for a smaller cloth and keep the baby's bottom over here from the lower back, and what you can do is pull this end over here and you can tie with the both sides. This is one way you can do a napping. To secure more, we can pull this edge towards here and tie it. So this way it will be good to cover the bumps of the baby. There is a second method of making a cloth nappy. The difference between this and the previous one is this can have a more cloth folding, so how much of a bigger or more volume of urine the baby is passing, this better clothing can hold on the urine, so you can prevent the bedding from become soiled. So what you can do is we are going to turn one corner of the sheet. You can use a smaller one because the baby's body will be a little smaller. I'm using because I'm teaching this particular thing. What you can do is you can pull one end like this so that the turn will come like this. You can turn it over back. And what we're going to do is we're going to fold this end like this, and we are keeping the thing straighter. Now what you can do is it becomes like a padded feeling where you can keep the baby over. You can keep the baby over here, and you can pull it over the private area of the child over like this, and again you can tie it over here. And once you are tying this, the part that is upper can be pulled in and you can tie it again, so that this will be more tighter and more clothing will be there. So when the baby passes urine, it will be held over here so there will not be any spilling of urine to the ground.